I'm Dr. Scott Brown, board-certified chiropractic neurologist in beautiful Lakewood, Denver, Colorado. And today I want to talk to you about one of the more frustrating conditions for people in our country, which is thyroid. Most thyroid conditions today, in fact as many as 90% of thyroid sufferers, are not suffering from a primary thyroid problem, but instead from an autoimmune thyroid, whereas to say the body is attacking itself. The number one cause of thyroid problems is Hashimotos, which is an underactive thyroid based on an autoimmune attack. The problem is that the treatments, both in traditional allopathic medicine and in alternative medicine, is for treating the thyroid when the thyroid really isn't the problem. It's an attack on the thyroid, mimicking a thyroid problem. And so the treatments are by and large ineffective. Now, some of the symptoms that you might have with a low thyroid function, as many of you know, but let's just run through it. Fatigue, weight gain, morning headaches, depression, constipation, sensitivity to cold, poor circulation, muscle cramps even when you're at rest, excessive need for sleep, and slow healing time. Now, some of the signs of these problems are dry, brittle hair, loss of hair, dry skin, the loss of the outer third of the eyebrow, and edema or swelling. Now, there's other conditions that can have some of these signs and symptoms as well. The typical treatment medically is with synthroid type drugs, and in alternative medicine the treatment is typically using thyroid supplements, and especially tyrosine, very dangerous we think because it actually suppresses the function of the thyroid. And so those of you who are getting tired after lunch, every time you get tired after lunch, you're losing part of your thyroid. This is an important thing to identify the real cause of the problem. Now, you've heard of iodine. In our society with the standard American diet, iodine is really typically not a problem. Iodine, because of all the salt in our diet and all the processed food, very few of us have an iodine problem. And it's very easy to check for a goiter. And if you don't have the goiter, the chances of having an iodine issue are very, very slim. Now, when to suspect Hashimotos or an autoimmune thyroid is quite simply if you have thyroid symptoms. If you have any symptoms of hypothyroidism, which we listed, or if you have on your blood work an increase in the thyroid stimulating hormone, or if you need to increase your thyroid hormones that you're already on, if you're taking the synthroid type drugs, or if you're non-responsive to thyroid medications, and with all these, if you have a normal weight, then the chances are you have Hashimoto's. If you're overweight with these symptoms, the chances are you have insulin resistance and or both. Now, in some less frequent instances, there's also an autoimmune thyroid condition called Graves' disease, which is hyperthyroidism. But this is not what we're usually dealing with. And there's ways to test for these. There's antibody testing that can be done to identify whether your T helper cell 1 or T helper cell 2 systems are dominant. But the point is, very simply, that in our society, these conditions are not addressed. You're simply given a substance for the thyroid, and then we never really get to the bottom of the problem. In brain-based therapeutics, we look at the brain, the metabolic system, and the gravitational stressors that drive these systems. We look at you as a complete person. We do a functional endocrine analysis, a metabolic assessment form, We have you fill out a neurotransmitter assessment form. We look at a complete blood work and any autoimmune testing that needs to be done. And we put all this together, and we treat these particular problems individually. Something you can do at home right now to support your thyroid, regardless of which direction you're going, is you can take something called vitamin D3. You should have your vitamin D levels checked. It's a simple test that now most people are doing in blood work because so many of us are deficient in vitamin D. And you should also be taking something called glutathione, which is the body's, it's like the super healer of the body. It's an antioxidant detoxifier that cleanses the liver, gallbladder systems and makes sure that you're not accumulating toxins in your system. There are less than 1,000 board-certified chiropractic neurologists worldwide, and so there's less than 1,000 of us that treat the way that I'm speaking to you about today. You can get on our waiting list if you're in the Denver, Lakewood area or can travel here. But first, I usually like to speak with you to see if you really fit our model of treatment, to see if it's really the right place for you. It takes a few minutes, and that way we can save time and effort for both of us. If you're not in my area, I would still like to help you. You can call my team. My website is www.browncnc.com. You can look on the website, get our information, and call our team. And I will try to find somebody that can help you with these thyroid issues. And I look forward to serving you in whatever capacity I can. Thank you.